Good morning, Gabriela. My name is Paige, and I'm a social worker here. Thank you for making time to speak with me today. I understand you've been going through quite a bit lately, and the medical team asked me to come speak with you, mainly to understand what's been happening from your perspective and how I might be helpful to you. This is a space for you to share whatever feels comfortable, and we can go at your pace. How does that sound?
Well, that's good. Thank you. Thank you for coming in to see me. I was really hoping that I'd hear from some of the nurses today about my test results, but it's past noon. I still haven't heard anything. So I'm
Mhm.
just I'm glad that you're here because I haven't really gotten to talk to anyone today besides my boys.
Okay. Thank you for sharing that. It sounds like you're feeling incredibly overwhelmed, especially with the uncertainty of these tests. Many people in your situation would feel that way. So to begin, I'd like to understand in your words what's been troubling you the most recently.
It's just waiting. I understand that there are many patients here, and I understand that everyone's doing their best, and it's just I I just I'm having a hard time not knowing what my test results are because I need to know I need to know what to do because if this if this test result shows that my cancer has spread, I need to make some choices. I need to make some decisions about what to do next, and I can't do that. And I'm really just having a hard time because I can't start making any plans until I know what I need to be doing with my time.
I hear the pain and fear in your voice, especially when you talk about the cancer and the uncertainty and just you know, a strong desire to know what needs to be done and what you need to take care of. There's just wanting to have some sort of, feeling like that you're in control, even in a situation that feels really out of control in a lot of ways.
Yes, yes, and I have been here before. I'm sure you've seen my chart. I've been through, several rounds of treatment. This isn't my first time coming here to this center for treatments and tests, and this feels different, and I don't know what that means. I don't know what it means that it feels different. But when I say it feels different, I mean before I could trust in the process. I could trust that everything was gonna be done the way it was gonna be done and the things would work out. But now I can't trust in the process because I know it could go either way. I know they could tell me that this is it for me and the cancer has spread, or they could tell me that I have some hope. So I really don't know. I really don't know what to expect. And it's really getting me down.
So it's really not just about the physical struggle of going through the experience of this coming back. I mean, you've been through that. It sounds like you've really been strong through all of those
Yes,
treatments and but this time it feels like more of an emotional struggle and like a question about what the future holds. Am
yes,
I
yes, because
understanding?
I've had 4 or 5 rounds, and I think that if it's spread, I don't think I'm gonna do the treatments anymore, and I'm okay with that. I'm okay with that. I just need to know if it's spread. I need to know that I need to call the hospice because I don't want my boys to have to take care of me
Right.
because they're grown-ups. They got their own lives. My youngest boy is going to be married soon, and they're boys, they don't know how to be caretakers. And
Sure.
I just need to know. And I'm lying in bed at night and I can't even sleep because I can't I can't put my mind at ease about what needs to be done tomorrow. I don't know. I don't know when they're gonna come through that door and tell me.
Mhm. It sounds like, well, since you bring up your sons, can tell that's really something very important to you is your family. And when I had the opportunity to speak to your sons earlier, they had mentioned you've always just been like the rock, is how they described you for your family. And it sounds like this is a significant shift from how you've always seen yourself. And being that rock for your family to feeling kind of helpless now, must be an incredibly difficult experience. And it's, um,
It is because it's all out of my hands now. I know, I've been there for my boys before, when their dad died, I was there for them, but that was different. That was different with this. There's just there's so much uncertainty. I can't, when their dad died, it was quick. It was quick, and it was that heart attack and he was gone. And there was nothing anyone could have done about that. And I just had to hold it together for them. But now it's like I don't know. It's they say you could be fine for another year, or this could be it for you. And it's that not knowing that has me in that place where I just feel so afraid all the time.
Mhm.
And I feel like if they at least told me, I could start to make my peace with either
Right.
way.
Right. Um, Feeling that constant worry sounds incredibly heavy to carry. You also mentioned poor sleep and some maybe impaired concentration.
Yeah, I can't sleep. I can't watch my TV shows. I can't even finish the book of crosswords my older son brought over to me. I just look at them and I can't focus on anything. I can't do anything. I tried to call my sister and I can't even focus on what she's saying to me.
so it seems like these feelings are really impacting your daily life. Is that right?
Yeah, I can't do anything because I'm just thinking this is going to be the moment when they walk through the door and they tell me. I
Mhm.
I can't it's taking over my mind.
Mhm. Well, Gabriela, thank you for sharing so openly. It gives me a much clearer picture of what you're experiencing. Um, Sometimes to help us get an even clearer and maybe a more structured understanding of certain feelings like worry and anxiety, how those things are impacting you, we use some brief questionnaires. They can help us track how things are going. Would you be open to
Yeah.
completing one that focuses on
Yeah, yeah,
anxiety?
yeah. I'm happy to do that if that would help you.
Okay, great. Well, the one I'm going to use today is called the GAD-7, and it asks about how often you've been bothered by certain problems over the last few weeks.
Okay, okay. So the last few weeks, that's even before I came in to the hospital, right?
Yes, so
Yes, yes.
before you came into the
Okay,
hospital, but I want you to primarily focus
okay.
on the time since you've been here,
Sure.
last 2 weeks. Um, Great. Okay, so for each question, please tell me if you've been bothered by it or whatever problem I described as not at all, several days, more than half the days, or nearly every day over the last 2 weeks, keeping in mind how you've been feeling since your admission here in particular.
Okay,
And
okay,
there are no right or wrong answers. It's just what feels true to you.
okay,
Okay. So, and I'm going to be taking note of your answers here. So just bear with me through that.
okay.
Um, all right. So, um, in terms of feeling anxious, nervous, or on edge over the past 2 weeks, how often have you
All
experienced
the time, all the
all the
time. I can't, uh, I, yeah, always,
time? Okay.
always.
So nearly every day.
Yes, yes,
Not being able to stop or control worrying.
yes, yes, especially since I got here.
Okay, so would you say more than half the days or nearly every day?
Every day, every
Okay,
day.
all right. Worrying too much about different things.
Yes, because it's not just me. I worry about my boys. And I think about if Tony has to be without me at his wedding, and I think about I think about Rico's kids, and they're gonna miss their grandma, and
Mhm.
yeah,
Well, would you say nearly every day again?
yeah,
That one
yeah.
now? Okay. Trouble relaxing.
Yeah, because I can watch my shows, and I can do my books and my crosswords, and I can call up my sister, and that makes me feel better, but nothing is making me feel better right now.
Okay. Being so restless that it is hard to sit still.
No, well, with the cannulas and this IV, I gotta sit still, but no, I don't feel restless.
Okay, so don't feel restless. So would you say not at all for that one?
Not at all.
Okay, all right. Okay, so becoming easily annoyed or irritable. Have you been experiencing any irritability?
I just with the waiting, I know um I've been calling the nurses station, and I think they keep brushing me off. They say the results aren't ready yet, and
Mm.
I try not to show it at them. I know they're just trying to work hard, but I just wish they would make this happen faster for me. So I guess a little irritable.
Okay, would you say that's several days, more than half the days, or nearly every day?
Maybe more than half.
Okay. All right, so last of these ratings. So feeling afraid as if something awful might happen.
All the time, and I don't know if that's because of this thing in my chest and
Mm,
this fluid buildup, but I feel
mm,
short of breath, and I feel sometimes I feel like maybe I might die here. I don't know. Yeah, so I do feel very afraid.
okay. Okay, well, thank you for answering those. So, and just one more question. So as for the problems that you said you've been experiencing, how difficult have they made it for you to do work or take care of things? Or, you mentioned your things that give you enjoyment usually or get along with others. Has it been not difficult at all, somewhat difficult, very difficult, or extremely difficult?
I think hard because, I'm not working. I haven't been working, but I can't do the things I normally do, and I think that I know I haven't been myself. I know my boys haven't liked to see me
Mhm.
like this, and I think it's been hard because I haven't been myself around them, and I feel bad for that.
Okay, so would you say that would be more somewhat difficult or very difficult?
I'd say very difficult. I want to be I want to take this with the grace I did before when my husband passed. I handled that. I want to take this like I did then, but I can't. And so it's making it very difficult for me. I want to be back there.
Mhm. Okay, thank you so much for sharing that, Gabriela. If you don't mind, I'm just going to take a moment to add up these responses and then we can go from there, okay? So just bear with me for a moment.
Okay.
Okay, so thank you for your patience. Based on your answers, your total score on the GAD-7 is a 17. And this score indicates severe anxiety. So based on the GAD-7 scoring, a score between 15 and 21 would be considered severe anxiety. And so um, does that resonate with how you're
Yeah,
feeling about
yeah,
your
yeah. It's
anxiety?
been I never felt like this bad before, and I never felt this bad before, and yeah, so it makes sense that this is what you found.
Mhm. Okay, it sounds like that number captures a significant part of your experience right now. So when you mentioned particularly the part that you had mentioned about feeling afraid or as if something awful might happen nearly every day. Can you tell me more about what that awful thing feels like to you?
My chest hurts, and again, I don't know if that's because of what's going on inside me, but my chest hurts and my heart feels like it's going really fast,
Mhm.
and I just feel like I'm running out of time. I just feel like the way I used to feel when the boys were little and I was running late to get them out the door for school, and I was late, and I didn't want them to be late, but I knew I was running out of time to get them to school on time, and I'd get so worried because I didn't want them to get in trouble, and I feel like that now. I feel like that feeling I'd get when I was running out of time.
Mhm. Um, so because you're mentioning some, chest pain and some shortness of breath, I'm gonna have the medical team take a look on at let also maybe check your vitals again to rule out any sort of um possible, physical system or um, thing that might be going on there. So we'll continue to discuss the anxiety and your score there, but we'll also take a look at your vitals again too, just to make sure there's not something else happening there.
Okay.
But as for the not knowing and the thought of not being there for your son sounds painful and terrifying, and that can be a form of grief. Grieving is not just what might be lost, but also the sense of control or certainty that you once had. And many people facing serious illness experience profound feelings of sadness and fear. And it makes complete sense that you would be crying and feeling worried and struggling to relax when you're carrying such heavy concerns.
Yeah, I never thought this would happen to me. I never smoked. And I'm still, I'm not young, but I'm not old. We got neighbors who are, 80s, 80 something, and they're okay. And I didn't I thought I was gonna have more time.
What what helps you cope even a little bit when these feelings become overwhelming?
I just thank God that my husband and I, we had the kids, we had them young, and that was hard, but at least they're grown up, and at least I know that Rico has his family, and I know that my baby is going to be getting married soon, and they're they're going to be good. They're going to be good even without me. They're going to have good lives, and I'm happy that I could at least see them be wonderful adults, and that
Mhm.
gives me comfort, and I'm comforted by the fact that if this is my time, I will be with my husband again.
Mhm. It sounds like your family and your background have always been a source of strength, and that this situation feels uniquely challenging because it impacts that very foundation. And you're right, this is true. It's true that this is a different kind of challenge. And what about your sons? While they're maybe a little frustrated or don't understand the specific type of grief that you're experiencing right now, they also express deep concern and they clearly love you very much. How do you think they're experiencing this, and how are you communicating with them about your fears and your hopes?
I I haven't really been talking to them about what's getting me down. I think they know I'm upset. They've seen me cry. Sometimes when they're here, I can't stop myself from crying. But I haven't told them everything that's in my heart because I don't want to burden them with, they're already worried about me. That they know that how this could go. I don't want them to worry even more. But I I I I think that I know it's hard for them to see me like this. It's hard enough to see me in this hospital, in this place, but I wish I could keep it together more when I saw them, but I just see them and I think about saying goodbye to them and it's hard for me to keep it together.
Gabriela, we've covered a lot today, and I truly appreciate you opening up and sharing such personal and difficult feelings. I have a much clearer understanding of your concerns and your worries about the future and your desire to be there for your son's wedding and the impact that that's having on your sleep and even your role within the family. So, um, as we've noted, your anxiety levels seem quite high right now. And I guess I want to see, as we think about moving forward, what do you feel like would be the most helpful for you right now? And what would you like to focus on?
Well, I think that if I could, well, I think there's a couple of things. The first couple days after I lost my husband, I couldn't sleep and I felt worse during the day just because I couldn't sleep at night. And my doctor, he gave me some sedative or something. I don't even remember what he gave me. It was like a sleeping pill or something. I took it just for a couple nights to get me back on track and it helped me feel better during the day. I don't know if there's something that could help me sleep. I could take that. If the doctors just tell me my test results, I think that will help, even if it's not the outcome that I want. I think it'll help to just know the results, but I know that's out of your hands, that's out of my hands. But I'm if you can talk to them, help them get me something to sleep or something else. I want I know I'm not going to feel good, but I want to feel a little more like myself.
Sort of relief.
And
Okay.
if are you going to come back tomorrow? Are you going to talk to me? Are you going to talk to me again tomorrow?
Yeah, we can definitely discuss that and as part of our next steps for sure. So, based on what you just said right now, though, about some things that you feel like could be helpful to you, um, as soon as I leave from here right now, I'll go check in with your medical care team and just get a quick update on where things are at with the processing those results, or just even if they might not have an answer or be able to tell me anything different than what they've told you, but I will still make a point of going and checking in for
Thank
you.
you.
And I'll also check in with your doctor about what some medication support might look like and what might make sense right now. So I'll definitely talk to your doctor about that. Um, and yes, I will definitely come back. How frequently? I mean, I could come back tomorrow just to do another
Yeah, yeah, if you
check-in
can
right
come back
away.
if
Hmm.
you can come back tomorrow, it's just, my sons are coming and they're coming, they're calling, but it's nice to have someone to talk to because I can't talk to them about some of these things yet. And so if you can come back tomorrow, I'd like to I'd like, because the nurses are nice, but they don't have time. They're in and out, and I don't want to slow them down chatting with them. So yeah, if you could come back tomorrow, that would be great.
Definitely. Okay, so yes, I will come back tomorrow. Let's plan for uh 2 tomorrow. Does that seem okay for you? It looks
Yes,
like
yes, that sounds great. I'm here. I'm not going anywhere. So I'll be here.
okay, so we can, when I come back and check in with you tomorrow, we can focus on strategies to manage your worry and the sadness you're experiencing, and we can perhaps explore some ways to improve your sleep and concentration. And one other thing I wanted to ask you about, we could focus on helping you communicate with your sons about what you need from them so you don't feel so alone in this. What do you think
Yeah,
about that?
I want them to know I'm not doing this to be difficult. I'm not acting like this to be difficult on purpose. It's just, I'm just having a hard time right now. I just want them to know that, and I want them to know that if this is going to end with me going to hospice, that
Mhm.
that I'll be okay and that they'll be okay too. And I want to have that conversation with them. I
Mhm.
just don't know that we're ready for that yet. So yes, if you can help us get there.
Okay. Wonderful. Gabriela, I'm glad that we could connect today. I will be sure to speak with your medical team to help them, to let them know about our conversation and how you're feeling, and with your permission, of course.
Okay. Okay.
Uh,
Yes. Hmm.
my priority is to support you, and working with your doctors ensures a comprehensive approach. And we'll schedule our meeting, check-in for tomorrow at 2. And would you like to meet every day for now, or
Yes,
every
yes, if
other
you
day?
can. I know you probably have other patients here that you're seeing, but I would like, I would like to, it's good. I feel a little better just saying some of these things. So if you can, whenever you or can come see me, I would appreciate it.
Okay. All right. I will do that. I will plan to check in with you at least once a day, for the next few days. And yeah, so thank you, Gabriella, for your openness today. I look forward to continuing our conversation.
Thank you.